May is Mental Health Awareness Month, a time to bring attention to and educate the public about mental health conditions. Right now, students are in crunch time with finals and graduation over the next few weeks, adding even more stress before the summer. Here with some helpful insight for parents this morning is Dr. Summer Rose from Communities and Schools of the Dallas region. Good morning, Dr. Rose. How are you?
I'm well, Tiffany. How are you?
I'm doing great. Thanks for joining us this morning on Daybreak. So first question for you, what are you seeing right now when it comes to the mental health challenges facing students?
Listen, we are seeing a little bit of everything. I think across the country, we're seeing a generation of young people carrying more stress, more anxiety, more uncertainty than ever before. I mean, I would also say that's probably true for us adults as well. But, these health challenges are not the exception anymore. Unfortunately, they were becoming the norm. And so here in Dallas, we see it every day. Students are navigating academic pressures, family challenges, economic challenges, and social dynamics. And sometimes it can just be too much to the point where earlier this week, we actually lost one of our high school students to suicide. Really struck by this and the fact that moments like this remind us that mental health is not an abstract issue. It's real, it's urgent, it is something that is impacting our young people right now. And so we have to shift. They are shifting and being more open and willing to open up and talk about it. And we, as the adults and the systems that support them, have to catch up to be ready to listen and to respond in time.
Dr. Rose, I'm so sorry to hear about the loss of that student. Can you help other families out there? What are some warning signs that parents and caregivers can look for?
Absolutely. So, the biggest thing that we tell parents and teachers to be looking for is changes in behavior. And in order to notice changes in behavior, you have to notice what the norm looks like. So you have to be in relationship with these students on an ongoing basis so that you can tell when they're starting to withdraw from their friends or activities that used to bring them joy, when they're becoming more irritable than usual, right? When their grades start to decline, when they're eating too much or eating too little, when they're sleeping too much or sleeping too little. And so really paying attention to those subtle changes in mood and behavior can make the difference. And then for parents in particular, we tell them just really, really important for them to be making space for honest conversations without judgment, right? As parents, it's really hard for us on that judgment piece because the most powerful thing a parent often can say is, I'm here with you and you don't have to go through this alone.
Yeah. How does your organization support students who might be struggling with their mental health?
Yeah, well, we know that connection is one of the most powerful protective factors for young people. And so when students have a trusted adult who sees them, hears them, and consistently shows up for them, that can change everything for them. And that oftentimes is our site coordinators, our site based staff that show up to schools every day to support these students that have the highest risk. We also have licensed mental health clinicians that will travel to our campuses that provide counseling, crisis intervention, coping skills, and additional resources to students and families.
Now, before we let you go, how can people get involved?
Please check us out. Go to our website at cisdallas.org to learn more. We love for folks to come out and volunteer their time and support our students. We also love for them to donate so that we can keep doing this very, very needed work.
Dr. Rose, thank you so much for joining us today. Now, we know these next few weeks can be stressful for students, but they'll have plenty of time to relax during that summer break. Thank you again for your insight. We appreciate you.
Thank you.